Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I am your host, Dr. Emran. On today's episode, we have a very special guest. His name is Dr. Gabriel Maislos, and he is a board-certified foot and ankle specialist right here in Houston, Texas. Dr. Maislos is also the sole practitioner at a clinic called the Houston Foot and Ankle Care Center, and we are delighted that Dr. Maislos is joining us today.
Thank you.
Very good, sir. Now tell me a little bit, sir, about your specialty. Can you tell me what made you decide to become a foot and ankle specialist?
Yeah, so I'm a podiatrist, and I'm 15 years now in private practice. My father is a cardiologist, and actually he just retired, so I kind of grew up around the medical field, and at a young age I saw the adoration and respect that my father received from his patients, and so I wanted to emulate his footsteps. And so my siblings and myself, we all went into the medical field.
Excellent. Very good, sir. And then I had a chance to visit your website earlier today, HoustonFootandAnkle.com. And on your website, you have a large number of resources. You actually talk about different foot and ankle conditions.
Correct.
Very good, sir. And then there was one in particular about plantar fasciitis. Could you explain a little bit about what plantar fasciitis is?
Sure. So plantar means the bottom. Fascia is a type of structure. It's a ligament-like structure. And itis means inflammation. So essentially it's inflammation of a ligament-like structure of the heel. So patients come in typically complaining of heel pain, greatest on first step in the morning or after periods of rest. So I like to explain plantar fascia is almost like a rubber band that is stretched out when people are weight-bearing, when they're standing. And then, when they rest or sit down, then it contracts, gets tight, so that the next time they bear weight, it becomes super painful, and that's where they experience the pain.
I see. Very good. And is this something that develops like in one day or a weekend, or is it something that's more chronic?
It's more chronic. So people develop plantar fasciitis from overactivity. So you see it in athletes because they're just constantly pounding their feet, and they're flattening their arch and therefore stressing the plantar fascia from where it originates, which is the heel bone. You see it in people that are obese because that's, the additional weight is causing the flattening of the arch, and once again, the stretching of the plantar fascia. People have it from trauma, or it's something that's a pain cycle, and sometimes it will resolve on its own, other times it requires treatment.
I see. Very good. And tell me a little bit about the treatment. In your office, if you have a new patient who presents for the first time to you, what are some of the first steps or first treatment recommendations that you offer for plantar fasciitis?
So first thing I want to do is differentiate, make sure that it is plantar fasciitis and not tarsal tunnel syndrome. So what I will do is I'll push on the inside of the heel, and if it elicits pain, then I know there's a plantar fasciitis component to it. Otherwise, I'll tap on the inside of their ankle, and if they feel a jolt going down to their toes, their heels, then that's indicative of a nerve entrapment. In that case, it would be tarsal tunnel syndrome, which is like carpal tunnel syndrome, but tarsal tunnel in the ankle. So after diagnosing them, I can use an ultrasound machine as well to diagnose the plantar fasciitis. I decide what's the next course of treatment. I always like to start off as conservative as possible, so that's usually stretching, taking an anti-inflammatory, applying ice. That's like the first line of treatment. Then after that, there's additional things such as a night splint, which is a device you can wear at nighttime, which will stretch your foot while you're sleeping. Because that's why it hurts the most in the morning, because at nighttime, when you're resting, it's just contracting, and there's no way you can stretch your foot while you're sleeping. Well, this is a device that allows you to stretch your foot while you're sleeping.
I see. Interesting.
So in addition, then after that, there's additional treatments ranging from ultrasound-guided steroid injections to injecting biologics, such as amniotic injections, PRP, and even now in the future, Botox.
Okay, very good, sir. And the night splints that you mentioned, are these custom made? Are they something you have to measure in your office, or are these something you can buy over the counter?
So the night splints are prefabricated. They're not custom made. Essentially, they, put your foot in what we call 10 degrees of dorsiflexion, where it's being brought towards your head. And it's just a more, essentially, the way you would stretch it normally when you're, trying to stretch on a curb or during the day, trying to stretch on your own. It's just bringing the foot towards you while you're sleeping. The custom device that we make are orthotics. Those are shoe inserts, and those essentially put your foot in the position it should be, which we call subtalar joint neutral. It corrects the pronation, the flattening of the arch. That's why people, when they get out of bed and they step down, once they put their shoes on, they feel better because they're getting that built-in arch support that's in the shoe, as opposed to walking just barefoot.
I see. Okay, well, that makes a lot of sense. And then are there situations where one foot is affected, or is it usually going to be both feet affected at the same time?
No, it's often unilateral, one foot. Sometimes it is bilateral or on both feet. But I see more often just one foot. And if it's both, it's one worse than the other.
Yes, sir. Very good. And then is there a role for physical therapy or aquatic therapy in helping to manage the plantar fasciitis?
Sure. So physical therapy can always help out in stretching, massaging, applying ultrasound treatment to the heel. There's also something called that I offer in my office called EPAT, which is like shockwave therapy, but it's basically high-pressure sound waves, and it's a non-invasive option for people that have an aversion to needle or would like to try something else before even considering surgery.
I see. Very good. And then the surgery that you mentioned, can you kind of guide me through what type of surgery is recommended in those severe cases of plantar fasciitis?
Sure. So surgery has come a long way as far as treating plantar fasciitis. Currently, what I like to use is what's called the single portal endoscopic plantar fasciotomy. That essentially means making one small incision, less than a centimeter in length, and using a camera to visualize the plantar fascia and releasing a third of the plantar fascia, and that releases the tension. Because the pain is essentially caused by the plantar fascia being too tight, and it's creating these micro tears and causing inflammation as it's being pulled away from the bone that it's originating from. So you're relieving the tension, therefore you're relieving the pain.
I see. All right, and that makes a lot of sense. And then after surgery, is there a certain amount of healing time, or is it a very rapid, quick response to healing and going back to normal activities?
Yeah, just like anything else, there's a gradual transition, but since it's minimally invasive, you can transition after the first dressing change just to a Band-Aid. And I still like to keep my patients, non-weight bearing for a couple of weeks to give it a chance to heal, but after that they can transition into the normal shoe attire.
Excellent. Very good, sir. Well, that's a very large amount of knowledge you just provided to us about plantar fasciitis. I wasn't aware of some of the other treatments that you just mentioned. I'm an ER doctor, so oftentimes I'll see people with foot problems, and we assume it's broken or it's not broken, and we kind of go from there. But what you're describing, I believe a lot of my patients actually suffer from plantar fasciitis. This may be something that I should refer more people out to your practice or other podiatrists in town.
We would appreciate that.
Very good, sir. And again, if you're just joining us on the show, I have Dr. Gabriel Maislos. He is a board-certified podiatrist. He is a foot and ankle specialist here in the Houston area. You can visit his website, which is houstonfootankle.com. He has a lot of resources on his website. You can also find out if he's in your insurance network and decide if you want to have a consultation with him. Can you tell me, Dr. Maislos, any last thoughts or other advice that you would have for our listeners about taking care of their feet?
I mean, just in general, just be aware that there are treatments out there that it's not normal to walk around with foot pain. There's many things that can be done, and one of the reasons I got into this specialty is because you can see immediate results. And, as far as for plantar fasciitis, one of the things that I'm most excited about is Botox, which there's a company called Revance, which has a phase 2 trial study, and it's showing more favorable outcome than the steroids, which has always been the standard treatment. And so I think it's a really promising treatment in the future.
Excellent. Very good, sir. Well, thank you so much, Dr. Maislos. I really do appreciate you talking about plantar fasciitis today. We will make sure to have your website and some of the additional information on our show blog, and that way our listeners can also follow along and reach out to you as well. So thank you again for making time to speak with us today.
Thank you so much. I appreciate it.
Thank you. And you've been listening to Simple Health Radio. I'm your host, Dr. Emran. We'll have all this information available very shortly, and I do hope to have you again on a future episode. Thank you.